I'm Dr. Sherri Wilson, and I'm the Assistant Division Director for Health Services for Fairfax County Health Department. And I have with me today Dr. Benjamin Schwartz, and he is the Director for Epidemiology and Population Health, also here at Fairfax County Health Department. Today, we'd like to share with you an innovative project we're working on to address food insecurity among the clients visiting our clinics.
Let me present some of the context for this work. Food insecurity is a problem in Fairfax County and all across the state of Virginia. In our county, there are an estimated 58,000 people who are food insecure, many of them over 28,000 estimated to be children. In the entire Commonwealth of Virginia, that estimate for food insecurity is about 800,000 people, suggesting that it's a problem in jurisdictions all across the state. We recognize that the clients who come to a health department clinic are likely to be at higher risk for food insecurity because one of the reasons they're coming to our clinic is they don't have the resources to get medical care, or in our county, many of the people who come to our clinic are undocumented immigrants and therefore are not eligible for other programs such as Medicaid. The program that we began was at our Annandale Clinic office, which serves predominantly a Hispanic population, many of them first-generation immigrants, new immigrants to the country, and also the majority of them who are Spanish-speaking. We used the validated screening tool, the Hunger Vital Signs, to ask questions about food insecurity. And then the clinic staff worked with the patients to provide resources, provide education and information. And let me turn things back to Sherri now, who can talk a little bit more about the interventions that took place.
Thanks, Ben. So we focused on our clients that came in for immunization services, so our children and also adults. At the point of check-in, our clients would complete the validated survey that Ben had mentioned, and that paperwork is then reviewed by the nurse when they are called back for their visit. If it is determined at that time during the assessment that the client that the client is food insecure, then the nurse provides the client with resources to access local food pantries. Included in those resources is a detailed map of all of the food pantries that are located throughout Fairfax County, and the client is provided that information. The client is also linked with a family assistance worker. The client can meet with the family assistant worker at that time, or they can make an appointment. The role of the family assistance worker is to evaluate eligibility for a variety of services that the client can access throughout the county, namely the MCCP program, WIC, dental, and access to a primary care medical home, a federally qualified health center. The visit takes an additional 10 to 15 minutes to include that component in the visit, and we have received great feedback, good feedback from the clients that they are connected to these services. I'm going to turn it back over to Ben, who will provide you some more information surrounding the data that we were able to collect as a result of this pilot.
One of the things that was important to us, given that this is a pilot study, and we were doing this at only one of our 5 clinics in the county, was to collect some data to see what the results of the program were, how well it was working, and therefore to support a decision of whether we should expand it to the other sites around our county. Since May, when the program began, we've screened about 1,000 clients, and 58% of them have screened as food insecure. And this is a much higher proportion than is seen in clinicians' offices or even in our federally qualified health centers that also have been doing screening. Of the 60% who were identified as food secure, unfortunately, only a minority of them, a little over 25%, did receive resources from a food bank or a food pantry when we called them to follow up and see what the impact of the screening was for them. There were a number of reasons that were advanced why people hadn't used the services to which they were referred. One is that they currently did not have a need for additional food, and we think that the resources are important because it gives them information that they can use whenever they have a problem with food insecurity. Many of them also cited difficulties with time or transportation, and certainly we recognize that time and transportation are linked, and that part of the problem getting around when you don't have a car is having to use the bus system, which takes an extraordinary amount of time, etc. So certainly the two are linked. We're working with our community outreach partners right now, with our colleagues from our Neighborhood and Community Services Department, to explore different potential solutions to that transportation problem. Other issues might include childcare, language difficulties, and some who had concerns because of their documentation status. One of the other things that we found in our follow-up was that a very large number of people who saw the family assistance worker were indeed signed up for other programs. There's the Medical Care for Children Partnership, linking up families, getting them enrolled in the federally qualified health centers, linking them with dental care services, and then a smaller proportion who were identified as eligible for WIC or for food programs such as SNAP. And so what we found was that we were not only able to address their needs for food, but we could also address many of the other needs for services that are experienced by this population.
So, again, thank you for your time, and we are very excited about continuing this work and our continued collaboration with Epidemiology and Population Health. For more information, please contact us at Fairfax County Health Department.